Okay, we can go ahead and get started now, I think. So thanks everyone for joining. My name is Owen McCarthy. I'm the Director of Data Analytics at PolicyMap. I lead the team that collects, processes, documents, and checks the validity of every single data indicator you find in PolicyMap. So today, I'm going to talk to you about all the updates we did in 2025, some themes we discovered while doing those sort of data update works in 2025 and the sort of data landscape of 2025. We're going to show you some demonstrations of how you can use some of those new indicators in your work. And we'll give you an extremely brief preview of what we are thinking about for 2026. Just as a little housekeeping to start, the webinar is being recorded and will be shared after. To get that, a follow-up email will be sent with the video and any additional information from today's webinar. And as you heard at the beginning, because this is a GoToWebinar format, everyone's muted. If you have any questions or problems with the webinar, please use the chat feature on the GoTo tool. My colleague is here and we'll be monitoring that, so please let us know if you have any trouble. With that, let's get started. So, themes from 2025. The big one that sticks out in my mind is delays and cancellations of federal data sources that we'd come to expect, right? So the big one is, I'm sure some folks remember around this time last year in 2025, the administration came into office and immediately started changing things, and specifically funding and programming cuts around a whole variety of federal data products and funding streams, especially around environmental justice. So the environment EJ screen, the Environmental Justice Index, the Climate and Economic Justice Screening Tool, and notably for a lot of folks, the Social Vulnerability Index from CDC, were all just completely taken down really fast. These are data sets that I think added a lot of value to, obviously not just us, just the whole country, in terms of understanding characteristics of communities and health and environment. So they were all a real loss. But they happen really, really fast. And a lot of these, I should say, we don't have any particular reason to expect are going to come back. The other part of that was government funding lapses, especially the full government shutdown in the fall, delayed multiple releases here. So CDC Places took a long time, was delayed for a very, very long time. Obviously, the BLS unemployment data, and I believe it was October, but I could be wrong. And then program data from the Capital Magnet Fund, the New Markets Tax Credit, and other CDFI programs were all delayed. The biggest one, which I can't believe I didn't even put down here, was, of course, the American Community Survey that was just released early last month. And I believe you can now find on PolicyMap, at least from the 2020 to 2024 5-year ACS. So that's exciting. But that's some of the bad news. In terms of slightly sunnier news, we added a number of new data sources in the past year, which I'd love to talk to you about. So we added 8 new data sources this year in a variety of areas. It actually looks like this is cutting off one of them. I apologize about that. So they broke down into a few different areas. In terms of sort of our new health data offerings, one of the things I talked about, if anybody was on the webinar I did last year, I believe it was go back to school rather. I talked about wanting to add to our library of healthcare access points, right? We had a number of layers that include the number of general physicians per 1,000 people, but not as many specific locations. So we've been adding to that a lot. So 2 big areas this year were Medicare accepting medical providers from the Center for Medicare and Medicaid Services, and the locations of health systems providers. The latter one, a lot of folks probably realize that there's been a lot of consolidation of healthcare providers in large hospital groups. I live in Washington, D.C., and very nearly every provider is in one of the 3 big hospital groups. And so that's been an interesting development in the healthcare landscape over the last few years. And so now you can see where those locations specifically are and get some information about some of the bigger health systems at a sort of network level. I should also say the Medicare accepting providers is neat because you can find not just the location of the clinic, but the filter by the types of providers that are there. It's really, really rich data. In terms of sort of household finances or affordability, we wanted to add a lot more about or enrich our sort of picture of incomes and poverty and sort of the level of need that people have by adding some other key sources right there. So the Urban Institute produces this wonderful estimate of medical debt estimates across the United States, which I encourage you to check out. The Department of Labor, I believe, though I can't promise it, I believe this is another one of the data sources that got pulled off of the website, but I could be wrong about that. Has really, really rich data on the cost of childcare by age, so infants, toddlers, school age, things like pre-K, things like that, including income, the average cost, the cost as a percentage of median family income, and what they refer to as an affordability gap. It's really, really cool data. And then the New York Federal Reserve produced a data set called Credit Insecurity Index, which makes it, as it sounds, it's an index of percentage of households or people in an area that are credit insecure, but they offer a lot of interesting data about why they have credit constraint, like whether it's bad credit scores or a lack of access to financial products, things like that. In terms of housing, we added a really interesting FEMA data set called the National Risk Index. That produces very small area estimates of damage from natural disasters by hazard meaning earthquakes, avalanches, floods, hurricanes, things, wildfires, things like that, and then risk. Notably, I'll show this in a few minutes, the expected annual loss from buildings and property and land and people if a particular hazard happens. And then we also, at the last year, released in partnership with our partners at Moody's Analytics and the Reinvestment Fund, very specific housing gap estimates. You can find a white paper covering that on our website. And then what's cut off on the slide here, I apologize again for that, is we created a new data set about these sort of important industries within area, especially the concentration of specific industries in specific areas. So for it's using a sort of complicated metric called the location quotient, but for some intuition, you can imagine looking at what the important industries were in, say, Detroit for most of the 20th century, and it would be like automotive and things like that. And so that's really sort of what it is. So it gives a nice snapshot view of the sort of local economies of an area. So we also added new indicators to PolicyMap from existing data. So these are indicators that you can really only find here, even if they come from public data. The rationale, we've been doing this, PolicyMap has been doing this for quite some time. One of our most popular indicators is the predominant race ethnicity data. And that's a good illustration of what we try to accomplish with these. So the race ethnicity data we get comes from the American community, and there's a lot of different categories. So if you were looking at a particular area, you have to look at 7 or 8 numbers just to try to get a sense of what an area looks like. The predominant race ethnicity simplifies that view and tells you this is the most common race or ethnic group in a given area. So we try to take that view as we create new indicators from the data that we already have, right? It's like, what about a particular data set is, rich and detailed, but also complex? How can we give a quick view or perhaps shorten our users' time to value by simplifying a little bit? So for some time now, we've hosted pharmacy location data from DataAxle. But then it was just a point data set. And as you can imagine, there were quite a lot of pharmacies, certainly in cities. So we created a very simple layer data, which is just the number of pharmacies in a given zip code or census tract, just to make it a little bit easier to contextualize that. And then we also made a metric of which pharmacies have recently closed. There's been a lot of attention on that, especially on the East Coast with the closing of many Rite Aid pharmacies. And so it's easy to see how a neighborhood might lose access to this kind of healthcare very, very quickly. We also created a predominant chronic conditions data set. This was based largely on a methodology designed by the CDC. But it answers 2 questions. So of all the chronic conditions in an area, which ones are most common, right? What is the most common chronic condition in an area? And then which areas, the index that they put together categorized each county, I believe, zip code, by whether it had a low, moderate, or high burden of chronic disease. What they mean by that, and we use their methodology, was just whether an area might have a high burden if it has a high percentage of people with a certain chronic condition, or lots of people that have chronic conditions, right? So either of those could lead to having a high burden. And so, but the problem is that there are a lot of chronic conditions, right? There are at least about a dozen that we get from CDC data. And so again, if you want to look at what is the generalized chronic conditions healthcare burden of an area, you had to look at a lot of numbers and click on a lot of different layers. And we tried to simplify that by showing you what the chronic conditions are in a specific area. So in a similar vein, we created one we call predominant housing tenure. Apologies if this is common knowledge, but housing tenure is a Census Bureau term of art. What they mean by that is owners versus renters. So there are a lot of, again, per the ACS, there's a lot of different indicators for home ownership in an area, especially over time. So we tried to create metrics that would answer a few different questions. Do people in an area mostly own or do they rent? What are the race and ethnicity breakdowns of home ownership and rentals, and how have those patterns changed over time? And like I mentioned, the last one being industry specialization. The county business patterns data produces truly spectacular data on the types of industries that are within an area. But of course, there's one of these data sets that has a lot of different possible categorizations of an industry. So we tried to simplify by saying, what are just the most common ones that you can find in that area? So obviously, I'm not going to try to dictate this is exactly the things you can do with these data. I think there's a lot of possible applications, just a few to come up to think about. So pharmacy closings, health systems, Medicare accepting provider locations. Like I said, we're adding to this growing portfolio of data that covers health access. Like where in a place for the people who live in an area, what sort of points of care do they have access to right there, right? And like I just said, predominant chronic conditions from CDC presents a much simpler view of health needs in an area. So you can pair those two things together and get a sense of, okay, these are the health needs of an area, this is the access they have, and draw conclusions from that, right? In terms of housing finance, I like the idea of using predominant housing tenure and the Moody's housing gap estimates to provide much more nuanced and small area information on local housing markets, right? So a lot of estimates of the gap in housing between supply and demand is best at the metro area level, excuse me. The Moody's data in their methodology puts it at a much smaller area. And you can look at that, see like this is the number of units a particular census tract is short, and pair that with, again, the characteristics of home ownership and rentals in an area and how that's changed over time, and lead to some really, I think, really interesting insights. Industry specializations and the disaster damage estimates from FEMA, I think, could enrich data on local markets through really understanding what critical industries are in an area and the value of land and property at risk from natural disasters. So I'll show an example of part of that in just a second. In fact, I'll do it right now. Bear with me while I change my screen. Let's try this. Okay, so I wanted to start sharing how some of this data could be visualized on PolicyMap using our multi-layer maps function. And so what we're looking at here is obviously the southeast of the United States. We have a few different layers up here. So first, using that credit security index, the percent of adults who are credit constrained, right? This is county level data, and I moved the minimum value to be about 12%. So, if you can just make out this sort of distribution, this histogram there, you can see this is farther along. So these are counties that have a reasonably high percentage of people who are credit constrained. The other area I wanted to, the next thing we add is the expected annual loss rating, which is that dollar figure from a specific area from FEMA's National Risk Index, which shows how much could be lost. And like again, like a lot of indexes, they take that dollar figure and categorize it based on with qualitative labels like relatively high and very high. So we selected, because we're looking at the Gulf Coast and the southeast border of the Atlantic, just those areas that had a particularly high expected loss rating. And then I wanted, so those are two new ones this year. I wanted to pair it with something that was a little bit more familiar. So the percent of homeowners who are cost burdened. And the view I'm trying to get here is not just what areas are at risk from natural disasters, but what areas are specifically at risk from having homeowners who may have a really hard time accessing credit and may not have the most flexible finances to begin with. So that if a disaster were to hit, obviously in the southeast of the United States, we're thinking about hurricanes and flooding here. But if a disaster were to hit, you might imagine a higher burden to rebuild, right? And so notably, what you'll see here is when I set these values, some of the, not all of Florida, if you just look at of course, the Gulf Coast of Florida is all built up, right? And so you can imagine that a lot of that area will have a high expected annual loss rating from hurricanes. But by focusing the view down on homeowners who are cost burdened and are relatively credit constrained, we can see specific problem areas. So not so much Fort Myers, Naples, and Sarasota, but yes, Miami, Fort Pierce, and Daytona Beach, or also Pensacola up here on the Panhandle, to say nothing of this area around Mobile, Alabama, or Biloxi, Mississippi. And so I think this is just an interesting way of using all of this data together to see, like, okay, so perhaps it's an obvious point to say that a lot of the developed coast in the Gulf and the Atlantic is at risk of natural disasters. But more specifically, where would people really run into issues with rebuilding after a large natural disaster? And so if you click on any one of these zip codes, you can see all the values here, right? So this zip code in the Florida Panhandle has 27% of the people who live there are cost burdened. And this is obviously not a wholly unrelated phenomenon, but the percent of adults who are credit constrained is relatively high at about 15% as well. So you can imagine the damage and the specific pain from rebuilding that this zip code would have if it was to be hopefully not hit hard by a natural disaster. So with that, I'm going to move on to a different view. So we talked about chronic conditions here and how we can look at both the twin views of needs and access, right? So here I've got us focused on Ohio and Indiana. I should say I preloaded all of these views because my browser was taking a little bit of a long time to render. And I didn't want to make everybody wait while the multi-layer maps showed up. So I've got a few views on here again. So one is the number of primary care physicians per 1,000 people. I'm not a public health professional, so I was looking around for what the acceptable rate for primary care physicians is for a population. There's obviously a lot of different estimates. So I conservatively said, okay, if a county has less than one physician per 1,000 people, I think we can say that that's low access, right? I also added on, went to the CDC chronic disease prevalence index rating. So again, they have applied a score. This is the CDC methodology. They applied a score to the percentage of people with different chronic disease and ended up and set percentile-based thresholds to what they would refer to as lowest, moderate, and highest. So I picked highest there to find those areas that have particularly high chronic disease prevalence. And then, because of course, when we're looking at the upper Midwest, excuse me, not the upper Midwest, the Midwest, you want to filter out some of the zip codes that there's a lot of farmland. You want to empty those out too. So I picked I'll be honest, an arbitrary population cutoff to show just those areas that might still be within metro areas and have an interesting burden. I think that's what you take away from this too, right? So if you were to look down around Columbus, you can see Columbus here doesn't really meet their chronic disease prevalence index rating is only moderate. They have higher than this, again, conservative threshold of primary care physicians per 1,000 people. But nearby Columbus, which of course I'm sure has like a great academic healthcare centers, you do have this problem, right? So much lower rate of primary care physicians, high burden, and a good number of people who live in this area. And that's to say nothing of, and you see this in an area too, like the Akron doesn't have any zip codes that meet this criteria, but the surrounding areas do. But then you get to places like Detroit, and you can see a lot of zip codes here really do meet that demand. So it's not strictly an urban-rural dynamic. I don't believe it is. To say that, and of course you can look at Indianapolis down here too and see like, okay, there really are a lot of areas that have the high burden and don't have arguably enough primary care physicians. And so I think this offers an interesting view of the sort of access and need dynamic that you can see in smaller areas around the Midwest. And one last view using the predominant tenure. So I'm looking at now the southern end of one part of New York City. So the southern end of Manhattan, the northern Queens, a tiny little bit of Brooklyn, and Jersey City. I was curious to see what neighborhoods might. Obviously, New York has very expensive housing, and has been home values have increased for quite a long time over this area, and especially as people get priced out of New York City, there's been a lot of outmigration to surrounding areas like New Jersey. And so I was curious to find places where this dynamic was a little nuanced. So if you can imagine a sort of overly simplified folk theory that as home values increase, perhaps renters get pushed out, I wanted to find census tracts where home values increase quite a lot, and yet they're still renter dominated. This is probably a story about the existing housing stock, but here, so you can see our predominant tenure metric. You have a few views here, so you can see tracts that are largely, but not dominated by owner occupation, and ones that are really much more high percentage owner occupied. These are census tracts we're looking at here. So I picked those that are just have at least 70% renter occupied. And then using census data, the percentage change in median home value. These are slightly different time periods. So as you can see, the home value has the most recent ACS release. We haven't updated this metric. So this shows the previous 5-year ACS value. So it's a little bit of an apples to oranges comparison, but I don't think it's that egregious. So all of these census tracts are places where home values increased quite a lot, at least 25%. And yet they're still dominated by renter occupation. Again, some of this isn't all that surprising in the lower parts of New York, but especially in Queens and Jersey City, which have very different types of housing stock, you can see that renters are not yet getting pushed out in any great numbers by increasing home ownership. And so there's clearly a lot of nuance going on in the local housing market dynamics of the New York City, of Manhattan, the outer boroughs, and surrounding metro parts of New Jersey. So I'm going to go back to my presentation. Quick. Okay. So I want to leave plenty of time for questions and discussion. So I'll do one more slide, calling this 2026 seems put possible on there, because truthfully we don't know exactly what the world is going to look like. Who does? But just to give one example, we thought 2025 was going to be about supporting companies that were taking advantage of a funding vehicle that was approved at the end of the Biden administration called the Greenhouse Gas Reduction Fund. As I'm sure people either know or could guess, one of the very first things that happened when the new administration came in was to cancel this program, try to claw back funding that had already been dispersed. And so there was all of a sudden no need we had done all this work to try to understand what sort of data could support the funding and programming decisions based on this funding vehicle, like what other data we could add to supplement that, and then it was all gone in a matter of weeks. So these are guesses, hopefully educated guesses, and hopefully not too bold. So we want to mitigate the disruption by continuing to work with existing data. There's a non-trivial chance. I don't think this is again a particularly controversial thing to assume. A non-trivial chance for future delayed or canceled data releases from the federal government. So we're just going to continuously monitor and try to stay on top of things. One thing we want to try to look into is look to ways to recreate some of the last federal indicators, right? So thinking specifically here, so when we were loading the Environmental Justice Index, one of the things that our team remarked on was like, oh, we have a lot of these indicators already. We just didn't put them all together in one place. So maybe that means we can recreate something, either that that metric or something very much like it using data that already exists. We want to focus the attention on one of the more popular data sets that CDC released, of course, the Social Vulnerability Index. So we're going to have a look there and see if we can get close to something that might not, obviously, it wouldn't, the problem would be whether we can keep it updated, but at least like fill the gap that the SBI left when it was removed. And then this is actually has nothing to do with the current priorities of the current administration, but there's this wonderful EPA walkability metric that hasn't been updated in, I think, 10 years. And so we might try to work on some of these ourselves and try to recreate or design a similar indicator. And again, we have this enormous library of data here at PolicyMap that represents 10 years of collection and processing and all this sort of insight. And so we really want to try to use that, excuse me, to build out more custom metrics. So our first big area to look at will be affordability. As I mentioned, we have now a reasonably complete picture in from a lot of different data sources about like what household affordability looks like. So we have income, we have poverty, we have housing costs, transportation costs, consumer and medical spending estimate, like a whole bunch. We just added credit, medical debt, a few other things. So we're getting together a lot of data around an individual household's budget. And so we want to try to create, we're currently exploring some custom offerings around that area, including going out and looking for more nuanced or detailed data points on some of the areas that we're currently missing. So as an example, transportation is one of the biggest costs, not as big as housing or childcare for a household, but it's a big one. It's currently in ACS data, it's pushed together with your mortgage and things like that. So we're just trying to see if we can break it out from there. And we want to we think there's a lot of value in these predominant indicators that we've been releasing. Again, there's a lot of indicators on PolicyMap, and it's easy to get overwhelmed. And so we think by adding these, we can, at least for some of our users, might be interested in seeing like, okay, I want a quick view of an area. What can I see about that there? So we're looking into a few areas like those as well. So that's basically everything I wanted to talk about. Thank you so much for taking the time to join with us. And I'm happy to answer any questions about last year, this year, any specific data questions that I can. If there's anything I can't answer, I'll go back to my team who might have a better answer. We can get back to you shortly. So yeah.
Right. Thank you, Owen, so much. That's some really informative updates to our data. Some good questions that did come in. I'll just kind of throw some out in, and you can try to see if we can answer them. Carol had a really specific question, which was she wanted to know what was the name of the data set that was missing from that first slide.
The data set from the first demonstration I did?
From the first slide that was cut off.
Oh, it's county business patterns, industry concentration. Let me see if I can very quickly come up with where you can find it in our taxonomy. But yes, it's from county business patterns. I think if you go to our search bar and search industry concentrations, you can find them. Sorry, I don't have it right at the front of my mind.
That's perfect. That's she said thank you, so that's perfect. Just a general question from Bernie about the ACS, if there were any new data sets in the release or any new indicators.
There are new indicators in this year's release, some really interesting ones around. The one that sticks out in my mind is more information about the cost of owning a home. So homeowners association fees and things like that. There's a few other ones around there, but look out in our March newsletter. There will be blog posts that detail all the new indicators that are released from there. And I should also say, like in previous years, our staff suggests custom indicators based on ACS data. So we have a few of those. Those are going to be released later in the second quarter.
Awesome. Sue had a question regarding the food access data from the USDA as it stopped tracking. Looks like the farmers market data was already poor quality. Do we have any ideas for that?
Yeah. The short answer, no. To be perfectly honest, this is the problem with losing access to federal data sources. Like often, there is no good replacement for it. You know, when they decide to stop tracking things, I don't know where many other places to get that kind of data outside of the Department of Agriculture. I mean, we're going to we try to look as we can for alternatives to these data sources, but it's not easy, and we still have to keep everything else updated. So we haven't given specific thoughts to USDA's food access data, but we can certainly look into it and get an answer of like maybe what options might be available, but it's not currently on our roadmap.
Yeah, and I think in the same vein, Robert had a question regarding the social vulnerability index,
Yeah.
concerning that it probably won't have an update because the last update was 2024, 2025.
Exactly. Yeah. So I mentioned at the end there, we aspirationally want to see if we can fill the gap from the CDC-SVI. A lot of these indexes are based on data, again, sort of like the EJI data that we already have. And so we want to try to fill in, see if we can recreate something like the SVI. Again, that's a big if. So no promises on when that might happen, but like it's definitely something we want to consider this year. In the meantime, it's a little bit out of date, but we're actually working on getting the next update for it. But the University of Wisconsin's Area Deprivation Index is not the exact same thing as the SVI. It does conceptually relate to some of the areas that the SVI does, and is on PolicyMap now. So you can always look at that too. And that one I anticipate being able to update this year.
Yeah, and Robert, we can share that directly too, so you can see it. Just a general health question from Danielle regarding, do we have any plans to import physician practice details mirroring the way hospital systems are currently displayed? That's a new one.
Physician practice details. Danielle, I apologize. I'm not sure I fully follow the question you're asking. Do you mean, you know, this is a primary care? So just as an example, my primary care physician is a group of nurse practitioners. Do you mean like this is so it might register in some of our layers as this is a primary care facility, but not that the fact that they are entirely nurse practitioners. So we do have, if that is indeed what you're asking, I apologize if I'm misunderstanding. Both the Medicare accepting providers and the health systems locations do allow, if you those are point data sets, and if you go into the filters, you can filter down to specific specialties, like general practitioners, or subspecialties like cardiology and things like that. I don't know if we have, and you can also, for the health systems, you can see the health system that a particular location is part of. There, I believe, I don't want to, I believe we do also have from the health systems data characteristics about the health system in general. So that, of course, doesn't say much about fully independent healthcare practices. I believe we're still missing that as a point of access. But if we can find a data source that would provide that we can load, we would certainly consider it. So again, I hope that's what you were asking, but if not, please follow back up and I'll try to answer it better.
Yeah, we'll follow up just in case, but yeah, I'm sure it's challenge of data as well. So a good question just regarding processes, but it's how do you calculate percent change? Is that an indicator option, or how do we get that? So I'm guessing that's probably a question regarding to some of the census data sets, or just in general.
Yes. Okay, let me share my screen very quickly. Go back to the browser. Okay, coming up.
Perfect. Yes.
All right, so let's get rid of this. And just the I gotta get down to the maps. So if you want to know if the question is how to access percent change, if you go to a particular indicator, you click on the variable, you can see a number of different options here, right? So this, in a particular area, let's see, let's go to the approximate sense. approximately where I grew up in Yonkers, New York. So this census tract, make it a little bit bigger, has, oh, whatever, let's just do Westchester County. So I grew up in Westchester County, New York. And of course, you can see this. If you click on it, you can see the time series. If you go, you can see the percent change in the last 5 years. Back to this. And it's increased. You can see it's increased by about just under 3.2%. And then I should also add, it's not ready yet, but we're going to be introducing 10-year percent changes because of the time periods we have in ACS. So the way we calculate it is with a lot of care and effort. I'll tell you, percent change is one of those metrics that sounds very easy to calculate, and sometimes it is. It's new minus old divided by old, but especially when you're looking at different time periods, there's a lot of things to consider. So especially if you were going back to see if we can. So this isn't a great example, but there are other percent changes that span decennial censuses, and so redistricting happens, and so census tracts especially might change. And so in addition to doing the basic math of how do you calculate percent change in any two numbers, you also have to account for the changes in boundaries given in a specific area. So this obviously doesn't really apply to counties like this, but to census tracts, they can change quite a lot. And so this is part of the reason why we take so much care in especially processing American Community Survey data, is to make sure that we calculate those exactly correctly. If you want detailed inputs on how we do the calculations, feel free to reach out and I can give you a more detailed response.
Perfect. That's definitely good. Seems like a general question from Vanessa about, do we have the most updated data versions on PolicyMap, or is there a lag between when data is made public and loaded to PolicyMap?
There is often a lag. The nature of loading this kind of data is that the data owners make changes whenever they please, and so we have to update our processing to bring them all in. And of course, when they make significant changes, like adding some new indicators, removing old ones, we have to adjust our process. We try to keep the lag as short as possible. Sometimes we're successful in that, sometimes we're less successful in that. We generally endeavor to keep to update data sets within a matter of weeks or at most like a month or two. We try to prioritize certain data sets, especially ones around housing, especially CRA eligibility, the new markets tax credit, things like that, that are specific to very time delimited funding programs. We try to prioritize those in favor of others. We also, another sort of, I guess, editorial decision you might say we make is sometimes we don't update data as frequently as the source does because it doesn't change enough and we want to give ourselves a little bit of flexibility. But there are some that we try to update every month, like so BLS data. So you can reliably, this is a long way of saying we try our best to keep data updated as frequently, like exactly up to date. But the data release schedule throughout the year is also very lumpy. So the summers are quiet, the fall and winter is busy, and so we don't always get it right away. But within usually a matter of weeks or at most a couple months, we have it up to date. And we hope that when the ones that are delayed, again, aren't specific to very time delimited funding programs or anything like that. So.
Perfect. All right. And then if there's any other questions, let us know. Some are coming in. Thank you for the data suggestions. We appreciate all those. We'll look into those. And then if there's any process questions about using the tool, we'll follow up directly as well. It looks like we have another question from Robert, which is revisioning data. Will PolicyMap provide access to early estimates of released data or only the most recent releases?
Okay, so assuming by early estimates or revision, you mean, well, okay, so there's a few things here. So I'm assuming you don't mean historical data, right? So we have, so in this case, take a very easy one, population. We have population data going back to the year 2000, right? So I'm assuming you don't mean that. If you mean revised data, we handle that on a case-by-case basis. Sometimes a data source will be very clear that there was, like, so to take a sort of vanilla example of this, the BLS regularly revises earlier estimates of unemployment, right? This is just a matter of, this is how the BLS does unemployment data. So, in the summer, they'll say unemployment in June was such and such a rate. And then in October, they'll say, actually, the unemployment in June was really a slightly different rate. So we take those revisions, in that case, we take those revisions as like the absolute correct, and we'll update them there. We treat that as part of the release. There are much less commonly some changes that data sources make that they don't really document why they made a change to earlier data, and we tend to leave them up just because we want to keep ourselves as sort of an archive for what prior releases really were. So it's again, apologies if that's not really what you were asking, but we tend to handle it on a case-by-case basis and endeavor to include as much historical data as humanly possible.
I think, yeah, it's tough to try to get a sense of what that could. There's a lot of different ways to understand the idea of early release dates for data. So I think it's good.
Yeah.
All right. If there's any other questions, I know Peter, you had your hand up, and unfortunately, we don't have a mic for this session. So if you want to just type in the question, we're happy to answer that as well. Okay, I think that's all the questions. Do you want to close it out for us, Owen?
Great. Well, thank you very much, everybody, again, for your time and for your interest in PolicyMap. As always, our team is available. We're constantly trying to put together the highest quality, most rich data into PolicyMap to make your jobs and lives a little bit easier. So please use the data suggestions. Please reach out with questions. We're a small team, so I'm always happy to answer any questions that come up. And thank you again.